All right, let's dive in. Today, we're getting into the latest and greatest in metastatic hormone-sensitive prostate cancer treatment. We're talking going beyond just those simple PSA numbers and really exploring how we can use some really cool imaging, the cutting edge stuff, to actually personalize treatment and get those outcomes we're all looking for.
Yeah, I think you hit the nail on the head. It's like unlocking a whole new level of insight, almost like having superpowers to really see what's going on.
Exactly. But before we get ahead of ourselves, let's make sure everyone's on the same page.
Yeah.
Just a quick reminder. PSA, that stands for prostate-specific antigen, basically. It's a protein that can be elevated when prostate cancer is present.
Right. PSA, it's been the gold standard for a while now, hasn't it?
It has, but think of PSA like a smoke alarm, okay?
Okay, I like that.
It lets us know something is up, but we need more info to figure out exactly what's going on and how serious it actually is.
Makes sense. We need to investigate further. Can't just rely on the smoke alarm alone, right?
Right. And that's where this idea of next-generation imaging, or NGI, comes into play.
I think what's really interesting is that while PSA is super valuable, it's a great tool, it can also throw us a curveball sometimes.
Oh, tricky PSA. What do you mean by that? How can it be tricky?
Well, think about it. You can have certain treatments that actually suppress those PSA levels, even when, get this, the cancer is still progressing. Kind of sneaky, right?
Whoa, hold on. So the numbers look good, but the cancer is secretly doing its own thing in the background.
Exactly. It's like a ninja hiding in plain sight. And the research actually backs this up.
I think I remember reading about this in some of the clinical trial data.
Yep, you're right. You see this in trials like ARCHES and ENZAMET. There was a significant number of men, it's a bit alarming, who showed actual cancer growth on imaging, even though their PSA levels looked stable.
So you're telling me the PSA was giving a false sense of security?
In a way, yes. Take ARCHES, for example. Almost 70% of the men, and this is crazy, who had radiographic progression, meaning the cancer was visibly spreading on the scans, didn't even meet the criteria for PSA progression. It's like they were flying under the radar.
Wow, almost 70%. That's huge. That's a huge disconnect between what the PSA is showing and what's really going on. Why does that happen, though? Are certain treatments just better at masking that PSA signal?
It's not really about masking the signal as much as it's about how the treatment itself actually works. Some drugs are really, really good at blocking the production of PSA, but that doesn't automatically mean they're stopping the cancer from growing. They're doing their job in one way, but not in another.
Okay, so if we can't always rely on PSA, how do we see through this smoke and mirrors, so to speak? How do we get a truly clear picture?
That's where these really cool next-generation imaging techniques come in. This NGI stuff. It's like, think of it as X-ray vision, but for prostate cancer.
X-ray vision. Okay, you've got my attention now, and I'm all ears. Tell me more about this X-ray vision. What kind of imaging are we talking about specifically?
Well, we have some really powerful tools in our arsenal now. Things like whole-body MRI, or WBMRI for short, and then you've got these incredible PSMA PATE scans.
Hold on, PSMA PATE. Break that down for me. What's that all about?
So PSMA, that stands for prostate-specific membrane antigen. Basically, it's this protein that's found on prostate cancer cells. And what's cool is these scans are designed to detect PSMA, which means we can see even tiny amounts of cancer that might be missed by other imaging methods.
If I'm getting this right, it's like you're highlighting those cancer cells, making them light up on the scan so you can't miss them. That's pretty amazing.
It really is. And the beauty of it is that it's not just about finding those sneaky cancer cells. NGI lets us understand how active they are, how aggressive they are, and that's key information when you're trying to figure out the best course of treatment.
It's like instead of just knowing the cancer is there, you can actually see what it's up to, how it's behaving. So much more powerful.
Exactly. Think of it this way. PSA gives you a general location. But NGI, it's like having a GPS, giving you those turn-by-turn directions to every single trouble spot. No more unnecessary detours. We can be super precise.
I'm loving that analogy. So if the imaging shows us the treatment is working, great, we stay the course. But what if it shows us it's not working so well? What happens then?
Well, that's where we can really start making some adjustments, right? We can potentially intensify that current treatment, or we can even switch to something else entirely, a different therapy. That's the beauty of this personalization, using this real-time imaging data to guide our decisions. It's a game changer.
It really is. And this actually ties into something else we saw in the research, this idea that the 6-month mark is this crucial turning point. Why is that time frame so important?
It's like a progress report. The 6-month mark is when we really start to see a clear difference in outcomes, and those differences are linked to PSA levels.
So if you hit a certain PSA level by that 6-month point, that's a good sign, right? Means you're probably on the right track.
You got it. One of the trials, the Titan trial, they were studying a specific treatment for MHSPC, and they found that men who had a PSA level below zero point 0.2 NGML by that 6-month mark, they had much better outcomes overall, and this held true regardless of the actual drug they were on.
Okay, so reaching that PSA milestone by 6 months, that's definitely the goal. But what about the guys who don't quite make it there? What happens then?
Well, that's where that NGI really comes into play even more, right?
Yeah.
It helps us tailor the treatment for those who aren't seeing that, that ideal PSA response by 6 months. Let's say the imaging shows, oh, there's actually a larger volume of disease than we initially thought. That might make us think, okay, maybe we need to step things up a bit, maybe intensify the treatment.
I see. So it's like a safety net, catching those guys who might be flipping through the cracks if we're only looking at PSA. But what does that mean? Intensify the treatment. What are we talking about here?
Well, it could mean a couple of things. We could add another medication to the mix, maybe switch to a stronger drug, something with a little more punch. Sometimes, depending on the situation, we might even consider chemotherapy. We know that can be really effective in certain cases of MHSPC.
So NGI is helping us make those tough calls, figuring out if we need to stay the course, change course, or, really bring in the big guns.
Exactly. It's all about maximizing each patient's chances of success. And we're doing that by, really looking at their individual situation.
And I think there might be some folks out there thinking, okay, this NGI sounds pretty amazing, but is it only for those tricky cases, those guys who aren't responding as well? And the answer is, well, no.
Yeah.
Even if you're responding well, NGI can still provide a ton of valuable information.
Absolutely. It's not just about catching problems early. NGI can actually help us make some really important decisions about using radiotherapy, even for the patients with those good PSA responses.
So even with a nice and low PSA,
Right.
there could still be some areas that need some extra attention, kind of like sneaking in a little extra help.
Right. Imagine this. Okay. The PSA is looking fantastic, but then that NGI shows us, oh, there are these little pockets of activity, tiny areas where the cancer might still be hanging out. These areas might be so small that they don't even register on the PSA yet.
Sneaking under the radar again.
Exactly. But with NGI, we can see them and we can do something about them.
I like it. So it's like having that super-powered magnifying glass, finding those tiny little threats before they become a bigger issue. What can you actually do about them once you've found them, though?
That's where targeted radiotherapy comes in, and it's really a game changer. We can use radiation to zero in on those specific areas and potentially wipe them out before they have a chance to spread. It's particularly effective in what we call oligometastatic disease.
Oligometastatic. That's a mouthful. What does that mean? Just break that down for us.
It basically means that there are a limited number of metastases, or places where the cancer has spread. And the research is showing that if we can hit those specific spots with targeted radiotherapy, we can see some really promising improvements in outcomes.
Like a strategic strike mission. We know exactly where to go, and we hit it hard.
You got it. And using NGI to guide the radiotherapy means we can be incredibly precise, hitting only the targets we want to hit and minimizing any damage to the surrounding healthy tissue. It's a win-win. Less collateral damage and more effective treatment.
So we've talked a lot about how NGI helps us see things better, but it can also help us get even more information through biopsies, right? I mean, can you actually do a biopsy based on what you see in the imaging? That's incredible.
You bet. Think of it as a biopsy with a GPS system built in. We can use NGI to zero in on the exact location of the tumor we want to sample. That means we're getting the most accurate, the most informative tissue possible.
Okay, I'm picturing this tiny little needle guided by a GPS going in and grabbing that sample. But why is it so important to be that precise? What kind of extra information can you get from a biopsy that's been guided by NGI?
Well, one of the key things is we can actually analyze those biopsies for specific genetic mutations. These mutations are the ones that are driving the cancer's growth. It's super valuable information because it can help us figure out which treatments are going to be the most effective for that particular patient. It's all about personalized medicine, tailoring the treatment to the individual.
So it's like you get the biopsy, you analyze it, and boom, you've got this personalized recipe for tackling that specific cancer.
Exactly. And speaking of personalized recipes, NGI-guided biopsies are really opening the door to some exciting new targeted therapies. For example, there's a protein called PTN that's often lost in prostate cancer, and we can look for that loss specifically in the biopsy.
PTEN. Okay, got it. What's so special about this PTNM protein? Why does it matter?
Well, you can think of PTEN as kind of like a brake pedal on cancer growth. When it's gone, the cancer has a free pass to grow more aggressively. The good news is that we now have drugs called AKT inhibitors that can target cancers that have lost PTEN. It's like we're cutting the gas line.
So by checking that PTN status in the biopsy, doctors can figure out if these AKT inhibitors are going to be a good fit for the patient.
Exactly. It's a great example of how NGI and biopsies work together to personalize treatment plans.
And this personalized approach, it goes beyond just those AKT inhibitors, right?
Yeah.
I think the research mentioned that NGI-guided biopsies are paving the way for other pretty amazing treatments, like something called targeted radiopharmaceutical therapy.
That's right. Remember how we talked about PSMA, how it's like a beacon on those cancer cells? Well, there are now therapies that actually use that beacon to deliver radiation directly to the cancer cells and nowhere else. It's like a smart bomb, seeking out and destroying cancer cells while leaving healthy cells untouched.
Wow, that's incredible precision. Do you have any examples of what those therapies are?
Sure. One that's showing a lot of promise is lutetium-177, or 170-thionyl-Lu for short, linked to a PSMA targeting molecule. What it does is it delivers this highly targeted dose of radiation straight to the cancer cells, minimizing side effects.
So we've gone from basic PSA monitoring to X-ray vision with NGI, then personalized biopsy intel, and now these amazing smart bomb therapies. It's mind-blowing how far we've come.
Like, it really is. And all of these advancements, they're changing the way we treat MHSPC. It's a whole new ballgame.
Okay, before we get too carried away with all the possibilities, let's bring it back down to earth for a minute. What does all of this mean for someone who's just been diagnosed with MHSPC? What should they be asking their doctor about? Feels like we've just scratched the surface, honestly, with all this incredible information. I mean, it's a lot to take in. Where should someone even begin, especially if they're just starting out on this MHSPC journey? What are the first steps?
Honestly, the most important thing is to have an open conversation with your doctor. Really communicate. Don't be afraid to ask all the questions, even the ones that seem silly, and really advocate for yourself. That's key.
That's great advice. But what kind of questions are we talking about? What should people be specifically asking their doctor? Can you give us some examples?
Definitely ask about those next generation imaging options we talked about, the WBMRI, the PSMA-PE scans, all that. Those scans can give you so much crucial information, stuff you just wouldn't get from PSA levels alone. It's like, looking under the hood, getting the full picture.
So really push for that detailed picture right from the start. Don't settle for just the basics.
Exactly. And don't be shy about discussing all the different treatment options, weigh the pros and cons, talk about those newer targeted therapies, the role of radiotherapy, all of it. Make sure you're on the same page with your doctor, that you understand the why behind your personalized treatment plan. It's your health, your journey.
It's about feeling informed, feeling empowered to make those decisions that are right for you, for your specific situation.
Couldn't have said it better myself. Knowledge is power, especially when it comes to MHSPC treatment. That knowledge, it can make all the difference.
Well said. Okay, before we wrap up today's deep dive, let's take a minute to recap. What are those big picture takeaways that our listeners should really remember? What are the key things to keep in mind?
Sure. So first, we learned that PSA levels, while helpful, they're not always the most reliable indicator. Some treatments can actually mask the cancer's progress, making things seem rosier than they actually are.
Sneaky PSA, right?
Right. But that's where NGI comes in. Those next-generation imaging techniques like the WBMRI and PSMA PET scans, they give us a much clearer picture, a more accurate snapshot of what's happening. That means we can tailor those treatments to be much more effective. It's precision medicine at its best.
And we can't forget that 6-month mark, that crucial turning point. If you can hit that PSA goal, less than 0.2 NGML by 6 months, that's a really good sign, a strong predictor of better outcomes down the line.
Absolutely. But for the guys who don't quite hit that mark, NGI can really help guide those treatment decisions. Do we need to intensify? Do we need to switch things up? NGI helps us answer those questions.
And then there's that whole world of NGI-guided biopsies, right? Unlocking all that amazing genetic information, helping us figure out which targeted therapies are going to be the most effective. It's like having a personalized roadmap for treatment.
And it's opening the door to some really powerful new drugs like those AKT inhibitors. They can completely change the game based on your individual tumor profile. It's pretty incredible.
Oh, and don't forget about those smart bomb therapies we talked about. Delivering radiation right to those cancer cells with pinpoint accuracy. The future is now.
It really is. It's remarkable to see how far we've come in personalizing cancer care. And I'm really excited to see what the future holds. There's so much potential.
It's inspiring for sure. This whole conversation has been eye-opening, and honestly, it feels like we're at this incredible turning point in cancer treatment. We're not just fighting cancer anymore, we're fighting smarter, and that's a game changer.
I completely agree. And I'm so optimistic about what this means for men with MHSTC. We've got a lot to look forward to.
We've covered a lot of ground today, but I hope our listeners walk away from this deep dive feeling empowered, informed, and hopeful about the future.
Remember, knowledge is power. Stay informed, stay curious, ask questions, and be an active part of your healthcare journey. You've got this.
That's a perfect note to end on. So until next time, keep those brains buzzing, keep asking those questions, and we'll see you back here for another deep dive.